Thank you for the introduction, and I must extend Debbie's apologies and disappointment that she's not able to be here today, and also extend a thank you to the Institute of Medicine for including us, or FNS, in this discussion. As the introduction provided, Food Nutrition Service is responsible for all of the domestic nutrition assistance programs in the United States, and so that includes SNAP, formerly known as food stamps, and then there's an array of other nutrition assistance programs, and Supplemental Food Programs Division specifically administers the WIC program. And before I get started a little bit on how we have used, FNS has used the IOM guidelines in practice and policy, I'd like to give you a little bit of a scope of the WIC program. The official title, I must say, is the Special Supplemental Nutrition Program for Women, Infants, and Children, but we all refer to it as WIC. And it provides services to about 40% of all women who deliver live births in the United States. And we provide services to almost half of all infants born in the United States. And that's data based on from the 2000 participant characteristics study. Also from 2010 data, about half of all pregnant women or half of all WIC participants enter the program during the first trimester. The vast majority after that, about 35.4%, enter in their second trimester, and then less than 10% enter in their third trimester. So we are trying to enroll women early, and as someone alluded to, sometimes they go to WIC before they go to their first prenatal appointment. WIC provides targeted supplemental foods. As you're probably aware, WIC has a defined food list that's different than SNAP in that we provide targeted foods that target specific nutrients for the life cycle. And in addition to the supplemental foods, as a nutritionist, I like to think that the nutrition services we provide are an important benefit as well, and that includes nutrition assessment, nutrition education, referral to health and social services, the promotion of physical activity, and of course, breastfeeding support and promotion. WIC has a very extensive peer counseling, breastfeeding peer counseling program that we're very proud of. As part of the routine certification process, all women are weighed and measured prenatally and in the postpartum. So WIC has few federal requirements in terms of what health data they collect, but anthrometric data is a required measurement that we actually can do at the clinic. And then periodically throughout their time on WIC, women are brought back in to be weighed and measured. In the postpartum period, I think we talked a little bit about WIC is unique in comparison to other programs in that we do continue services through the postpartum period for 6 months if a woman is not breastfeeding, and for an entire year if she is breastfeeding, and that is part of our effort to incentivize breastfeeding. So through their participation in WIC, they're periodically brought in, and anthrometric measurements, and then individualized nutrition education and counseling is provided. The Institute of Medicine pregnancy weight gain guidelines were very useful to the WIC program in that obviously as a program we rely on other professions and experts in the field to give us the guidance to know how to evaluate and assess appropriate weight gain and appropriate preconception weight. So when the Institute of Medicine published their 2009 report, we did go through and change our policy and our practices. And so as of 2011, all WIC clinics across the country and actually in the U.S. territories use the 2009 IOM weight gain guidelines in their assessment and monitoring of women. In addition to the policy implications, we have also included the weight gain guidelines in our WIC participant fact sheet. We have USDA provides, developed several fact sheets, and this is tips for pregnant moms. So those, the 2009 guidelines have been incorporated into that fact sheet as well. And as part of the, I would say, the emerging public health issue of the idea of the periconceptional or preconception health care, WIC has provided funding fairly recently for the WIC Periconceptional Nutrition Grants Program. We have partnered with UCLA, and the, I won't get too much into the grant process, but UCLA has awarded 7 research grants. They were just awarded this last fall. And the 7 academic awardees will each partner with a local WIC agency. And the study topics include examining the impact of a short interpregnancy interval and weight retention, maternal overweight and obesity, and innovative nutrition education interventions. And then we hope to have those findings provided and presented at a conference in 2016. And in closing, I would just like to say that WIC acknowledges that it is an important program and part of the effort, and we are a willing partner in educating women about the appropriate maternal weight gain and achieving the IOM's goal of educating women about healthy prenatal weight gain. Thank you.
Okay, our next speaker is going to be Michelle Lawler, and she is the Deputy Director of the Division of State and Community Health in the Maternal and Child Health Bureau of the Health Resources and Services Administration, HRSA. She is a nutritionist by training and served as the project officer for HRSA in the IOM NRC weight gain during pregnancy, re-examining the guidelines, report, and recommendations for the current work to implement these 2009 guidelines. So, Michelle?